Good afternoon, everyone. I am so honored to stand on this stage tonight. My name is Dr. Taryne Mingo, and I am here to share the lived experiences of the women and men who participated in my 2020 qualitative research study titled Exploring Historical Racism on the Health of African Americans, or DAIS, in Late Adulthood During a Global Pandemic. At the height of the pandemic, March 2020, just 3 years ago, the CDC issued a statement acknowledging that persons who were 65 years or older were most vulnerable or susceptible from dying from COVID-19. In the following month, the CDC then issued a statement acknowledging that Black and Latin Americans were dying at disproportionate rates in comparison to the virus, in comparison to their white counterparts from the virus. In the same month, the US Surgeon General at that time acknowledged that while Black and Latin Americans were not genetically or biologically predisposed to get COVID-19, he still called upon these communities to step up and avoid alcohol, drugs, and tobacco. So sitting in my living room in April 2020, I thought, wow, here we all are in the midst of a global pandemic, and Black and Latin Americans have been identified as being most vulnerable to this new deadly virus, which at the time had no vaccine. And the immediate and only response was essentially, do better. I did later learn that the former Surgeon General retracted those statements. However, that report was not televised. So we may never know the full impact of the half-truth narrative regarding the health of people of color, which unfortunately is still very common today. What I do know is that racial health disparities have existed long before the COVID-19 pandemic. And so, folks, I just couldn't sleep after that report. So I decided to put pen to paper, metaphorically speaking. I love my MacBook. And I decided to complete this half-truth narrative by using research to provide a historical and contextual analysis regarding the compounded effect of racial trauma across the lifespan, specifically highlighting the voices of descendants of Africans enslaved in the United States, or DAIS citizens, who were 65 years or older and had lived in the Jim Crow South for the first 15 to 25 years of their life. So beginning December 2020, I began conducting interviews with participants who met these qualifications. And the first 10 interviewees this was actually done before there was an availability of a vaccine, and they were featured in my very first article titled, When Surviving Jim Crow Was a Pre-Existing Condition: The Impact of COVID-19 on African Americans in Late Adulthood and Their Perceptions of the Medical Field. I am grateful to say that by the conclusion of my study in December 2021, I had conducted 19 interviews in total. Now, I should mention that my research focused on the experiences of DAIS citizens was not to suggest that non-DAIS Black citizens were not also impacted by racial trauma over time. But my research really wanted to highlight generational trauma, specifically dating back to the Atlantic slave trade, transatlantic slave trade, the 400 years of chattel slavery, redlining, generational poverty, segregation, just to name a few, and how these events still impact the lives of DAIS citizens today. And so I decided to take this information and talk about, well, what does that mean across the lives of my 19 participants, or how were they weathering? So the term weathering, coined by Arlene Geronimus, who talked about stress associated with racism, weathers the body at the biological level, more so how life experiences can become biology. Linda Villarosa highlighted this term further to acknowledge how various ways of indifference to Black trauma has been perpetuated in both healthcare and science for centuries. Her research specifically focuses on racial trauma and pregnancy among Black women, but she deduced that it was not race, but racism that has a significant impact on one's health and life outcomes. So consider, if you will, a 2-story house, and despite it being very well built, strong foundations, up to code, passed all inspections, insulated windows, solar panels, a Category 3 hurricane comes through. And the house is still standing, but there's been a bit of damage, a bit of weathering. The paint is chipped and faded. There's a little rain in the basement, and some of the foundations have weakened. Nonetheless, the owners of the home take the next year to repair, restore, repaint, reestablish those foundations. In the following year, around the same time, a Category 4 hurricane comes through. This time, there is significant damage to the home, and it is noticeable. Windows are broken. Foundations have cracked. Rain has completely flooded the entire first floor. 75% of the possessions are gone. Nonetheless, the owners take time to once again repair, restore, reestablish those foundations. They have time to grieve the loss of possessions. They also have insurance cover most of the home's basic necessities in preparation for next year's hurricane. So consider, if you will, the bodies of Black and brown people as the house in that scenario. And the hurricane is racial trauma in all its forms: overt, covert racism, intentional, unintentional slurs, microaggressions. Why does everything have to be about race? And do we really need to talk about the past? It's so divisive. Unlike the previous scenario, the hurricane is not once a year, and there's very little time to grieve before the next hurricane arrives. Also, unlike the previous scenario, the weathering is not as noticeable. According to my 19 participants, they felt that it was through the intentional acts of faith, resilience, perseverance that allowed them to endure hurricane after hurricane, whether the next hurricane was tomorrow or in the next 10 minutes. So all participants acknowledged being descendants of Africans enslaved in the United States, hereafter referred to as Deus citizens. All were 65 years and older. Most of my participants were women. Most came from the state of Georgia. All participants acknowledged having varying degrees of health conditions, with one participant acknowledging being terminally ill as a result of his military years, being one of the first Black pilots who was exposed to the chemical agent orange. The purpose of my critical phenomenological study was to explore how Black Americans over 65 years of age described the compounded effect of racial trauma effect of racial trauma and the COVID-19 pandemic on their mental health and well-being in the Southern United States. So before I share what my participants had to say, I want to first establish that racism is trauma. Discrimination has been associated and is recognized as a high-risk factor on health, and continuous stress associated with racial discrimination has had an impact on aging. Also relevant to my study, racialized healthcare contributes to medical mistrust and a reluctance to seek treatment as a result, or delay seeking treatment for fear of bias or stereotyping by a healthcare professional. So at the conclusion of my study in December 2021, I, along with one of our amazing counseling doctoral students, shout out to the future Dr. Kiana Haynes, I invited her to help me with data analysis as we understand the narratives that were shared by participants. We found themes connected to dehumanizing experiences as a result of structural racism, workforce discrimination, long-term racialized healthcare, and how these experiences contributed to their perceptions of COVID-19, the vaccine, and why they felt so many Black Americans were dying at disproportionate rates from whites from the virus, many of whom acknowledged the high representation of essential workers during the pandemic. So I would ask you all here to bear witness to the narratives that were shared with me. These will be narratives of pain, narratives of survival, narratives of resilience. The names have been changed to protect confidentiality, and they were selected by the participants themselves. And I selected excerpts from transcripts that I felt were most commonly shared across participants. So all participants talked about the way it was, acknowledging the painful reality of enduring racial trauma, that hurricane from childhood to late adulthood. Many talked about their interactions with the KKK and the traumatic experiences of integrating into predominantly white schools. Alf said, I remember the whites-only signs, and the white students had buses at that time. We would walk home along the road, the white bus would come along, the white kids would throw paper spitballs or whatever out the bus at us. Barbara talked about the psychological trauma of going to a segregated beach as a child. She said, even the beach was segregated by a rickety old fence. The white side had an amusement park, but our side had maybe one vending machine. One thing that always reminded me of my interview with Barbara, she just talked about how as a child, she could not wrap her head around how a beach could be segregated. She said, it's the same ocean. Our participants also, or at least we found that there were gender differences also amongst our participants and their relationship with racial trauma. Sam stated, as a man, you had to learn how to avoid being attacked by white people or arrested. If a white person come right down in the middle of the sidewalk, you had to get off, get on the dirt or the grass till they pass. Lucy stated, as a Black woman, you had to be careful around white men. There were a lot of biracial children. You had to be careful. If he raped you, who would say he didn't? Consequently, another participant that I interviewed named Eli, a biracial man, and who also celebrated his 72nd birthday yesterday, he acknowledged how his family was kicked off of the white-owned farm where his family worked as sharecroppers when he was discovered. So these dehumanizing experiences were also reflected in terms of race-based wage earnings that, though it was in the past, still affects their income now. Wesley stated, it impaired my retirement earnings. It has impacted me and stifled my earning power today. Billy D stated, I went into the workforce. We, Black officers, were always the last to get promoted, to get pay raises and everything. So over time, if you look at it, that's why I feel African Americans are still behind financially. Billy D also shared with me how he, as a Black policeman, was only allowed to make arrests in Black neighborhoods and how the N-word was used quite frequently amongst white supervisors. But he said, that's just the way it was. Participants also talked about racialized healthcare and the barriers they faced even as children. Totally stated, back in the day, they had a room for the Black and they had a room for the white. And you wait till he, the white doctor, was through with all white people, and then if it was 10 p.m. at night, he'd come on in. Angela stated, Grandma, most of the time, was a doctor. Even when she needed surgery, there was no hospital around that would take Black people. So whether the care was inadequate or non-existent, many participants felt like this contributed to their social dispositions of health today. Stacy says, the experiences of lack of access to healthcare over many years have contributed to our inabilities to stay healthy over time and to buy healthy food. Michelle stated, oftentimes we don't get healthcare professionals who care enough about us to try to understand us, to communicate with us in ways that could lift us up and take care of ourselves. Nina, as I'll share her narrative here in just a second, also acknowledged the ways in which she felt her nephrologist did not consider her concern. She had a nephrologist who was strongly encouraging her to go to a predominantly Black dialysis center. And she said that though she was more than comfortable going to the newly constructed dialysis center with new facilities, the nephrologist ignored her request. She said it was, after all, a predominantly white new facility. Nina stated, they made me feel like, okay, maybe they don't want my blood going through the same equipment. Even though they've changed the equipment, you gotta sit in the same chair. They make me feel like they didn't want my Black blood going through a machine that the whites went through. Once again, another example of this weathering, this racial trauma that can affect one's mental health and well-being. And so healthcare provider bias was also recognized in our study as a contribution to many of our participants' perception of the COVID-19 vaccine. Sissy stated they already see us as collateral damage, that we're not adding to society anyway, that we're food stamps and government assistance. Zette stated, my grandparents and I were afraid to go to white doctors. Now they're gone. But feelings I have still about going to a white doctor, don't trust them. So a lifetime of dehumanizing experiences as a result of structural racism, workforce discrimination, long-term racialized healthcare has placed the inequitable weight of COVID-19 on a population of people who are still weathering, as reflected in Cinderella's, and my final narrative that I'll share with you. She says, I know highly educated Black people that won't take the vaccine. There's historical mistrust. We don't know if this is a trick, almost like this is how we're gonna get rid of y'all. So folks, we need change. Neglecting racial trauma across the lifespan allows for the continued blame to be placed on Black people. We also need real solutions. As a therapist, I implore mental health professionals who are supporting senior Black clients to adopt a lens of empathy, who may still be navigating history, trauma from their past that may be affecting them today. Keeping in mind that DEA citizens are not a monolithic group, and there may very well be people, citizens, who see the past very differently and have had different experiences, even though they too endured structural racism, racialized healthcare, and workforce discrimination. What I would ask that you all take away from this presentation, amongst all the things that I've shared with you tonight, is for one, my participants made it very clear that they did not see themselves as victims. They saw themselves as warriors who had been in battle for a very long time. And I don't know about any of you, but I don't look upon the scars of a soldier and see weakness. So then why do we, as a society, as a nation, look upon those very same scars, direct descendants for whom built this country under threat of death and violence, look at them and say, do better? I would ask for empathy. Please do not gaslight people of color when they talk about the past, especially when it is still affecting them today. I am grateful that the CDC did acknowledge and change the definition, certainly since the conclusion of my study, to acknowledge social predeterminants of health, the non-medical factors that influence health outcomes, specifically the forces and systems that shape the conditions of daily life, including economic policies and systems, social norms and policies, climate change, and racism. I want to also say thank you to those who have paved the way for me to stand on this stage tonight, including those who participated in my research studies, many of whom are watching this live presentation right now. Thank you. My name is Dr. Taryne Michelle Mingo. I am the daughter of Linda and Nate Mingo Jr., the granddaughter of the Mingo, Let, and Laban family, and I am a direct descendant of generations of warriors, healers, and survivors, and by God, we are still here. I am my ancestors' wildest dreams, and I thank you all for listening to my TED Talk.